And let's have a look at the latest developments now in the coronavirus pandemic. The Johns Hopkins University says that the global death toll has topped 300,000. There are more than 4.4 million confirmed cases worldwide. South Sudan has registered its first death toll from the coronavirus. Slovenia has called an official end to its pandemic, becoming the first European country to do so. And after a 2-month shutdown, restaurants, cafes and bars are reopening in Australia's most populous state, New South Wales. Well, one key weapon in the fight against the coronavirus is widespread testing to help pinpoint and to isolate infected people. But in much of the world, those tests are scarce. German doctors have traveled to Colombia with some precious cargo and valuable experience to help keep people safe.
Inconspicuous boxes filled with hope. Hope for Colombia to get a hold of its invisible enemy. This delegation of epidemiologists from Berlin arrived in Bogotá with precious cargo. 80,000 tests and a lot of experience.
We all have a lot to learn from each other. What's been the best way to improve healthcare provisions? Which have been the best social distancing measures? But we also have to cooperate to improve scientific research and make sure virologists and epidemiologists can share their findings.
Dr. Cristian Popescu's team came to Colombia at the government's request. In collaboration with local experts, they hope to improve testing capacities, especially in remote regions that lack an adequate infrastructure to face the pandemic.
Our goal is to establish testing in the north of the country, along the border with Venezuela. The region is home to a large, vulnerable population. We want to make sure that these people have access to safe diagnostics to enable the implementation of effective public health measures in the region.
Knowing where help is needed is crucial for the mission's success. In one of the country's top labs, the team from Germany learns that things are in a very different way to back home.
In one of our research projects in Germany, we processed 60,000 samples between January and April, with the help of robots. Here they told us that they processed the same amount of samples manually, working 17 hours a day. That's very impressive.
But the battle against the virus isn't only fought in sterile labs. It's the work on the ground that makes the biggest difference. The German doctors join local healthcare officials checking up on people in the Kennedy neighborhood of Bogotá. No district has been hit harder than this one, home to many of the city's most disadvantaged.
Between 25 and 30% of the population are considered vulnerable. They can't self-isolate. They can't quarantine because they have to make money for their families. So it's not only a public health problem, it's also a social issue that needs to be addressed simultaneously.
The socioeconomic reality in Colombia has little in common with that in Germany. But as countries move closer together to defeat the pandemic, these differences become irrelevant. Building on the lasting benefits of scientific exchange, Dr. Popescu's mission is meant to be but a first step in a cooperation it's hoped will outlive the common enemy.
Well, people in central Bolivia in South America have defied shutdown orders to protest against coronavirus restrictions. The country has been under lockdown since mid-March, and many residents want it relaxed. They've called on authorities to provide water and food. There have been over 3,000 COVID-19 cases in Bolivia and around 140 deaths. The United Nations has warned of a brewing mental health crisis brought on by the coronavirus pandemic. UN Secretary General Antonio Guterres says that governments and health authorities need to take action immediately to support the millions of people who are suffering psychological ramifications in the fallout from this pandemic.
Her name is Navila Germani, and she's been fighting coronavirus on the front lines in Albania for more than 2 months. That's enormous personal sacrifice.
I have a 15-month-old daughter. I also have a 10-year-old son, and I have parents who could be at risk because they also have other health issues, and that scared me.
At this Washington, D.C. food bank, the hardship is economic. With millions laid off and school meals gone with the lessons, families are also struggling to cope with the mental stress brought on by hunger.
It helped to me because right now I'm struggling with a child and I don't have many food stamps left. It's getting to the end of the month, so every little bit helps keep the house going steady.
Now the United Nations is urging governments to be proactive.
The COVID-19 pandemic is now hitting families and communities with additional mental stress. Those most at risk are frontline health workers, older people, adolescents and young people, those with pre-existing mental health conditions, and those caught up in conflict and crisis. We must help them and stand by them.
Psychologists in the UK are trying to help, creating a number of cartoons to help families manage the additional strain of lockdown.
All the early signs, a lot of families are struggling. And that's not a surprise, really, when you think about it.
Members of this support group for people suffering from depression or bipolar normally meet on Bondi Beach, but social distancing rules have forced them online.
People sharing their own stories makes you not feel alone, that it actually puts some perspective on your own life. And I think perspective is really important. Certainly in these times now.
And it's a fresh outlook that international bodies say is now vital to ensure COVID-19 doesn't leave millions more struggling with mental health problems.
And as we have heard, healthcare workers and others are suffering severe stress from their work fighting COVID-19. One hospital in Mexico has taken on a special new employee whose mission it is to help relieve that stress.
Preparing for work on the front lines. And during a pandemic, you can never be too careful. Meet Harley, the 3-year-old pug who works 2 hours a day at a Mexican hospital to help raise spirits among healthcare workers.
Some colleagues want to carry Harley or play with him right away. We have to consider the long-lasting deprivation of physical contact. It's significant, especially for staff on the front lines, who have even segregated themselves from their own families to avoid the possibility of infection.
Harley's owner, Lucia, says she's surprised by all the smiles Harley's brought out of the healthcare workers treating patients with COVID-19.
He's been an important buffer against all kinds of stress, psychological, mental, and emotional, that we as health professionals experience on a daily basis.
During the long, grueling days of work in the coronavirus section of this hospital, hopes are high that little Harley can bring some positivity.